how many days sugar level will go down after following the medications?
As far as our medications are concerned, since we are using extract based medications and the best of extracts are used, so a patient can expect improvement in the blood sugar levels right from the very first dose of medicine itself. If the patient is a recently diagnosed patient, the improvement comes right from very first dose. If the patient is in a habit of taking insulin or has been taking allopathic medicines since long, the improvement will be a bit slow to come as far as the blood sugar levels are concerned. So it will depend upon since how long a patient has been diabetic.
What are the metabolic correctors that you are providing at Indicare Nirogam Private Limited?
There are various kinds of Ayurvedic herbs which are mentioned in Ayurveda as Sroto Shodhak Oshadhiyan. All those medications which are Sroto Shodhak Oshadhiyan are having metabolic corrector effects. For example, Karanj is one of them. There are various other kinds of herbs of this category which, when provided, they act on the cellular level. And when we talk about cell, when we talk about metabolism of a cell, ATP, ADP, Golgi bodies, then mitochondria, there are various small organelles of the cell which are involved in the micro functioning inside our body. These herbs, they act on all these levels so that they can keep a check on any kind of damage that is occurring inside the body, maybe due to aging, maybe due to underlying chronic disease like diabetes, maybe due to any other reason. These metabolic correctors are just like a protective shield for our body, which shields us from all kind of catabolic activities.
Does the patient needs to follow restricted diet and lifestyle modification as suggested by other physicians in allopathy? Is it true for Ayurveda?
See, I won't say it's a restricted lifestyle. I'll say it's a better enhanced lifestyle. If a patient is doing yogic pranayam for 30 minutes in the morning and 30 minutes in the evening, what is the restriction in it? Rather, the patient is doing something as an addition. So it will be an enhanced lifestyle that the patient needs to follow than a restricted lifestyle. As far as the commodities, the eatables which a patient can consume are concerned, it entirely depends upon how good a lifestyle a patient is leading. If a patient is leading a very good lifestyle, even with a bit of mistakes in the eatable part, the body does manages. But if the lifestyle is not that good, then the patient definitely has to take a lot of restricted diet.
How many days patient has to take medications? Is it lifelong?
It again varies from patient to patient. As I previously commented, if a patient is a patient who is newly diabetic, recently detected diabetic, it is comparatively easier. If a patient is a patient who is diabetic since very long, it is comparatively tougher to get rid of complete range of medications. But if the patient is having strong willpower and the patient is following all kinds of do's and don'ts that we are guiding, a patient can expect the complete withdrawal of medicines at some stage of our treatment. But then, as I said, it entirely depends upon how dedicatedly the patient is following the do's and don'ts that we have recommended.
Can patient take allopathy medications along with Ayurvedic in diabetes?
Definitely a patient can take allopathic medications along with their Ayurvedic medications because there is no drug interaction between both those kinds of medications. Especially with our medications in diabetes where we are using herbs, we are not using metallic preparations. There is no drug interaction between our medications and the allopathic medications. Slowly and gradually, as the patient goes on improving, the blood sugar levels are managed, the patient is feeling more and more energetic, the patient won't require the usage of allopathic medications, and it is at that level that the patient can slowly decrease the quantity of medications, the dosage of medications that he is taking in allopathy, and then at a stage the patient can say goodbye to all those medications.